Good afternoon, and welcome to the City Club of Cleveland. My name is Jan Roller. I'm president of the City Club's Board of Trustees. The City Club was established in 1912 to encourage debate, discussion, and a free exchange of thought. We are very proud that it is the oldest continuous free speech forum in the country. Today's topic, Cleveland's proposed Medical Mart and Convention Center, is precisely the type of issue for which the City Club was established. The Medical Mart has been controversial, the subject of great attention, and it holds the hopes and dreams of many people here in Cleveland and beyond. It was recently described in Crane's Cleveland Business as a golden opportunity, one that could fundamentally change the foundation of economy and business here in Cleveland, an opportunity that could completely transform the face of commerce in Ohio. Crane said, the Medical Mart will make Cleveland command central for displaying medical devices and innovations. It will create a world of collateral career opportunities for those graduates who pursue fields of basic medical science, biotechnology, bioethics, research, public advocacy, and public policy. Years have already been invested into the vision of the Medical Mart. In 2007, the county passed a 1/4 cent sales tax to help fund the $425 million project, and a site has been chosen at St. Clair Avenue and East 6th Street. Today, we have key players in the project who will be introduced by WCPN's Eric Wellman. The City Club firmly believes in the free expression of all ideas and the benefits of an open exchange like the one we will have here today. So let the discussion begin. Eric?
Well, thank you, Jan, and thank you, everyone, for being here. I'd like to commend the City Club for hosting such an important conversation. Basically, what we have here today are the 3 leading proponents of the Medical Mart and Convention Center project here in Cleveland. To my far right is Dr. Toby Cosgrove of the Cleveland Clinic, and this is a concept that basically he proposed, I know publicly about 4 years ago, but it's something that he's been thinking about and talking about for quite a long time. In the middle is Cuyahoga County Commissioner Tim Hagan, who's really led the push for the Medical Mart project on the county level. And then to my immediate right is Christopher Kennedy, who's the president of Merchandise Mart Properties Incorporated, which is the Chicago-based company that's going to be actually developing and operating the Medical Mart and Convention Center for a period of 20 years. So I'd like to welcome all of you. And let me just give you all an idea of how this is going to go. They are each going to speak about their role in the process for about 5 to 7 minutes each. I've got some questions prepared that I'll be asking them, and then we will be turning it over to you in the audience to ask your questions. It's the City Club's traditional question and answer period. So let me begin with Dr. Cosgrove. I'll turn the floor over to you.
Well, thank you very much, and it's a pleasure to be here. This concept really started perhaps 7 or 8 years ago when I was in the Middle East and they were discussing the possibility of building a Medical Mart in Dubai. And I immediately thought to myself, why on earth not Cleveland? Then when I became CEO, I became increasingly concerned in my role and the Cleveland Clinic's role in the economy of Northeast Ohio, and I thought that this was one of the things that I could think of that we could build on, that there was no like mechanism or anywhere in the world. Now, why did I think that this was a good idea? Well, in the process of developing hospitals, I have to tell you that a big part of the building of a hospital is the cost of the equipment that goes into it. The Miller Family Pavilion cost us around $550 million, and 1/3 of that was the equipment that went inside the hospital. In order to bring that equipment to the hospital, it was necessary to travel really all over the world. I was in Germany, I was in the Middle East, I was in Alabama, I was in Michigan, and just looking at various pieces of equipment, and there was no place that brought together all the equipment that would go into hospital in one place. And so I thought there's an opportunity here to do the same thing that I had seen done in the Merchandise Mart in Chicago and furniture marts in various places around the United States, where if you were furnishing a house, everything that you would need to furnish that house would be in one location. So you could go and look to rugs to curtains, artwork, kitchen equipment, etc. Well, we have the same problem when we furnish a hospital. And what's happening in the hospital building industry right now? Well, it's very interesting. Hilbert funds built a huge majority of the hospitals around the United States in the 1950s. And those hospitals are now all 50 or more years old. So they are being rebuilt. And as population shifts, new hospitals are being built in new locations in the United States. But not only are hospitals being built and refurbished in the United States, that same thing is going on all over the world. There's a building boom in hospitals around the world. And as the economy of the world goes up in various underdeveloped countries, one of the first things they want to do is have health care. And so they're building hospitals. Billions of dollars worth of hospitals going up all over the world. And no place where you can go and see all the gear that goes into it. Now, what is the gear that goes into a hospital? Well, it goes everything from the imaging equipment, which is huge multi-million-dollar pieces of equipment, to the bed linens. So you see sterilizers, operating room tables, televisions, beds, all those sort of things that go into a hospital. And yet you also have to have special flooring, special window treatments, special beds, a huge amount of material that goes into building a hospital. So I thought that you could bring together in one location all of this equipment, which would in turn attract those people who either inhabit the hospital, build the hospital, think about constructing the hospital, and then subsequently there's the possibility of all sorts of secondary industries coming to populate around this mart. Hospital architectures, office designers, office equipment people, all of those could potentially populate around this, much as the Merchandise Mart in Chicago is populated by interior design shops all the way around it for several blocks. And industries that have grown up around that. Now, so the question is, why would I propose that for Northeast Ohio? The answer really is for the economy. I did not think that the Cleveland Clinic had a stake in this. I personally certainly didn't have a stake in it. But there was an opportunity to bring something which did not exist anyplace else to Cleveland, which would attract people and stimulate the economy on for a number of different ways. So at that point, I was searching around for someone to begin to help get this off the ground, and I contacted Jane Campbell, and I contacted Chris Kennedy, and put the two of them together. It took a little talking to each one of them to explain my idea. But very quickly, both of them sensed that there was a potential here that they would like to continue to push and explore. So that's the origin, that's the thought of what it could do for us as a community. And I think the nice part is it plays on the new economy. The economy which is based around not steel and car manufacturing, but around use of our intellectual capital. So I think that this is off to a start that could potentially bring a big opportunity around a city who can certainly use some economic stimulus.
Thank you, Dr. Cosgrove. Commissioner Hagan, if you were to pick up the story about the beginnings of your involvement.
Well, I'm here because Toby Cosgrove in the Cleveland Clinic saved my life.